Welcome back to West Texas View.
Erika Thomas is our guest today, and she is with Odessa Links, which is an opportunity for people who need help to connect one place, and then they will connect that person or that family with all the helping agencies that can meet some of their needs. And one of your big events every year is your annual conference that's primarily for helping agency professionals.
Yes.
But everybody is invited. People that are interested, maybe nurses or policemen or anybody that might be interested, even though they're not connected with an agency that would be considered a helping agency. So tell us a little bit about that conference, and then we'll get into the program.
Okay. Well, we're actually bringing in our third annual community conference with the workshop focus being Bridges to Health. This is actually a continuation of our two previous conferences where we brought Bridges to Poverty. Really great content. We've had great feedback, and so that's something that we want to continue and keep going. And so this year we are honing in on the health industry. So that's community service agencies, health professionals, social service agencies, anyone that deals with someone at the poverty level and wants to improve their ultimate health outcomes, or reducing health admissions or readmissions. People that, like I said, they see people that might see that their health is deteriorating and are trying to reach through to them and may not be as effective as they would like. This would be a great workshop for them because they're able to look at previous research, look at different mental models and different approaches as far as how to reach out to those people and communicate in a way where they can take that and eventually improve their health with those different resources. So it's a really great interactive workshop. We're actually doing it 2 days. We're providing it 2 days, March 31st and April 1st. This conference is brought to us by Medical Center Health Systems. Along with them, we have other supporting sponsors like AmeriGroup, Health South, Complex Community Credit Union, Rivercrest, First Five, the Permian Basin.
And you're still taking sponsorships.
Well, yes, we definitely welcome sponsorships. We including UTPB Nursing, Texas Tech Health Science Center, which is where we're actually having the conference. And then, of course, Permian Basin, AHEC, as far as they're the ones providing the CEUs for some of our health professionals. So we definitely invite anyone and everyone that wants to participate and overall improve as far as their health outcomes for their patients or the
Approximately how many conference attendees do you have?
So last year we had close to 175. So this year we've increased it to 200 a day. And so since we're providing it on 2 different days, same content, we're looking at a total of possibly 400 conference attendees. And not just for here in Odessa, but for surrounding areas. So we're really, really excited to bring this here and to get our health professionals on board to the Bridges content, because that means us as service providers, we're not only on our own mission to get people to a healthier and better place, but so are our health providers. And if we can join forces in that sense, then again, we're delivering people with the utmost care, and we're all there to leave people better than what they came in. So like I said, it's great partnerships, working with all the different health industry and health professionals, and that just kind of helps our community overall and be more cohesive.
And so what's the cost, and how does somebody register for it?
So we go through Eventbrite, eventbrite.com. That's where we have our registration. They can go online, they can type in Odessa Links, they can type in Bridges to Health for Odessa, and it should pull up. And once they do pull up, they'll see that our tickets are very affordable. We're keeping it at $50. That includes
the CE
certificate. Yes, breakfast, lunch, your CU credits, and then of course the book, the content. we really try to keep it affordable so we can have more people attend and be exposed to this content. And if you're a student, you actually get it at a discounted rate for $25. So we're even reaching out to those that are still in school, still trying to, you know,
gather every bit of information for the real world.
Yeah, and like I said, if we're able to reach people at that certain level and they're able to adopt the good practices as far as helping people in different socioeconomic classes, then, you know, that's someone down the line that could probably teach someone else or expose them to, you know, I found that this is a good practice when dealing with someone that might have I don't know, whatever barriers that they might be going through on top of living in poverty conditions.
And I heard you make a statement that really stuck with me. You said that when you are in poverty, health is your last thought.
Yes.
And it's a luxury to get any kind of attention to help you better your health.
Yes, you know, I think a big one that's become a reoccurring theme is food security. You know, when you're not eating every day, you know, your health is deteriorating. You know, you're at that point, you're starving. You know, that doesn't help as far as in your decision making. It doesn't help as far as the stability wise, because if your health is deteriorating, you're probably going to the hospital. You're not able to maintain a job. There's different scenarios that impact that. So it's definitely, like I said, important.
And one of the things that we also have to think about is that when you're in poverty and you've got these priorities, the last thing you're thinking about is who's out there to help me, because you've been slapped down so many times. We're going to have to take a break right now. We'll be back and continue this conversation in just a minute.
Stay tuned. West Texas View will be right back.